And we're at the new location of Coastal Vascular and Vein Center. They're expanding, and here to tell us more about it is Dr. Adam Kiefer. Dr. Kiefer, thank you for joining us.
Thank you for having me.
And tell us how big this expansion is and why you decided to do it.
We are very excited to announce our expansion plans up here. We are now offering services for vascular surgery 5 days a week at our North Charleston location. So patients can expect to have a consultation with a board-certified vascular surgeon, and then oftentimes get diagnostic imaging such as ultrasound at the same visit.
Now let's talk about your PVD, PVD patients and what they can expect and how they will be better served here.
Absolutely. Patients with peripheral arterial disease or blocked arteries in their legs often have problems with walking or pain when walking. Patients who come in to see us here at our North Charleston location are able to get diagnostic tests to further evaluate their peripheral vascular disease. But what I think is really exciting is that patients now can get treatment in the form of balloons or stents in an outpatient setting.
Done right here.
This is done at our other office at our Ashley location. However, the diagnosis and the initial assessment is all done here at this North Charleston office 5 days a week.
That's good.
That allows the patients to avoid hospitals, which can often be time-consuming and heavily cost.
Absolutely. Now, what about your patients who suffer from varicose veins when it comes to diagnosis and treatment? Yeah.
That will all be done here at our North Charleston location. Patients can come in, have ultrasound imaging of their varicose veins, further define their venous anatomy, and then subsequently get treated right here at our office with our cutting-edge technology.
And of course, with your expansion, that means that you have brought in additional help.
Absolutely.
And
we have hired a physician extender, Brittany Tucker, our new PA, to help further staff our 5-day-a-week office up here.
All right, and we want to bring her in now.
Thank you.
Brittany, can you tell us how you're able to assist the doctors here?
Yes, I'm a physician assistant, so what I'm able to do is sort of act as an extension of the doctor. So if the surgeon is ever at the hospital doing an emergency surgery, anything like that, I can serve here in the clinic, sort of practicing in the manner that he would practice.
And so the patients would know that they're also in good hands when they see you.
Yes, definitely so. Definitely.
Because you are certified. And
yes.
That's the most important thing. Now, how are you able to manage your dialysis patients with your vascular lab?
We are able to manage our dialysis patients because we can evaluate whether or not their dialysis access points are working appropriately. And they can come into our office to have that monitoring done as opposed to going to the hospital for an inpatient study.
Okay, and I think that's pretty good too. Now let's talk about this. I did hear, is it true that you guys sometimes have same-day treatment for whatever issue they may have?
Yes, and that's very important as well because we are able to see a patient, do a screening study for them. If we find any sort of issues that need to be treated, then oftentimes we're able to treat that in our office on the same day in our endovascular suite. So that's very important.
Versus them having, getting diagnosed there, finding a problem, and then having to make another appointment and come back. You can do it all on the same day.
Exactly.
I think that's all good too. Now, if someone has any issues or they might have any questions or they think they might have problems with PVD or varicose veins, how can they get in touch with you guys to make an appointment?
They could just look up our office online at Coastal Vascular and Vein Center and then find our number on there and call into our office.
All right, Brittany, thank you so much.
Okay, thank you for having me.
All right, stay with us. More Low Country Live coming up after the break.